Hello everyone. My name is Nadia Qureshi, and this is my semester-long project for my Lifespan and Development course at St. Edward's University. In this video, I will be giving a comprehensive overview of attachment theory and how attachment changes over the human lifespan. The 5 specific stages of life that will be discussed are infancy, from birth to 2 years of age, early childhood from 2 years of age through the 6th birthday, middle childhood from ages 6 to 12, adolescence from the beginning of puberty through the 18th birthday, and emerging adulthood from ages 18 to 25. First, I wanted to give a brief introduction to attachment theory and its history. Attachment theory first gained notoriety within developmental psychology through John Bowlby and his published works during the 1970s and 1980s. Bowlby described an attachment behavioral system that was innate to humans and other primates, and that motivated individuals to seek out attachments with so-called attachment figures in a strategy meant to promote survival and mitigate stress. Originally, attachment theory focused primarily on the parent-child pairing, also known as the parent-child dyad, but has broadened to include all relationships over an individual's lifespan. The later work of Hazan and Shaver would produce the concept of attachment styles that are perpetuated into adulthood and are based on prior attachment during infancy, childhood, and adolescence. Infancy is arguably the most heavily observed stage of life when it comes to attachment theory. Attachment during infancy is regarded to be critical in determining attachment style later in life, impacting individuals' relationships even into adulthood. As put by Gurm et al., infant attachment is theorized to lay the foundation of emotional regulation across the lifespan, and these patterns of emotional regulation, which will be further discussed once we get to emerging adulthood, determine individuals' interpersonal skills. One of the most famous studies of attachment theory is Mary Ainsworth and her strange situation procedure, developed in 1978. Used to assess attachment within the parent-child dyad, Ainsworth's experiment would observe infants' reactions to being placed in a playroom before being separated from their caregiver and introduced to a stranger, and then later reunited with their caregiver. The most important facets of the strange situation procedure were the infants' interactions with the stranger and their interactions upon being reunited with their caregiver. The experiment outlined 3 main attachment patterns: secure attachment, insecure avoidant attachment caused by cold and rejecting care, and insecure resistant attachment caused by inconsistent care, with some choosing to include a 4th category known as the disorganized attachment pattern, though this category is heavily debated by developmental psychologists in regards to its validity. Children who presented with the secure attachment pattern exemplified the ideal for infant attachment. In the presence of their caregiver, they felt encouraged to explore the new playroom while occasionally returning to their caregiver, and when separated from their caregiver, they would express a sense of stranger wariness and begin to cry. When reunited with their caregiver, they were comforted and would eventually feel safe enough to continue with their play. Children with either insecure attachment pattern presented with undesirable behaviors, either on separation or upon being reunited with their caregiver. The infants with the insecure avoidant attachment pattern showed little to no stranger wariness and would ignore their caregivers upon being reunited. Infants with the insecure resistant attachment pattern would become extremely upset after being separated from their caregiver and would express anger at their caregiver upon being reunited, sometimes hitting their caregiver or resisting physical contact while simultaneously seeking comfort. Children who fit into the 4th category of disorganized attachment generally presented with behaviors from several other categories or behaviors that were inconsistent. Later in this video, we will discuss how these patterns correlate to certain behaviors in adults, but for now, let's move on to early childhood. For the purpose of keeping the information on these developmental periods concise, and because many research studies tend to lump them together, I will be talking about early and middle childhood in conjunction with one another. It's during the window from 2 years of age to 12 years of age that attachment patterns begin to influence children's behavior and development in measurable ways. I'll note that the language around attachment patterns changes slightly when discussing children from age 2 to 12. There are 5 categories of attachment that are recognized by developmental psychologists: secure attachment, anxious resistant attachment, anxious avoidant attachment, disorganized attachment, and insecure other attachment, which was used to describe the attachment patterns observed in children rescued from Romanian orphanages, whose attachment patterns weren't necessarily disordered, but had never fully developed in the first place. In one revolutionary and ongoing study known as the Minnesota Longitudinal Study of Risk and Adaptation, infant attachment has been shown to impact children throughout early and middle childhood through differences in the development of certain skills and characteristics, such as self-reliance, emotional regulation, social competence, patterns of adaptation, situational variations, behavior patterns, and psychopathology. It was found that children with insecure attachment patterns during infancy had more difficulties in becoming self-reliant, struggled with emotional regulation in the form of aggression and frustration, and had lesser degrees of social competence, which caused them to struggle with maintaining friendships. Children with insecure attachment patterns also had difficulties in adapting to different social situations and were frequently rigid, either depending on teachers and counselors for comfort and emotional expression in the case of anxious resistant children, or acting as more of an observer than a participant in activities in the case of anxious avoidant children. A more fascinating finding was that while anxiously attached children were at a higher risk for psychological issues by adolescence, it was the children who were designated as having disorganized attachment that were significantly more likely to receive a psychiatric diagnosis. Overall, children with disorganized or insecure attachments have been found to participate more frequently in externalizing behaviors, or behaviors that are harmful to others. Children in early and middle childhood become eligible for the diagnosis of an attachment disorder if their attachment patterns are debilitating enough to meet DSM criteria. Attachment disorders were introduced to the world of clinical psychology via the DSM-4 and currently fall under two diagnoses: reactive attachment disorder, or RAD, and disinhibited social engagement disorder, or DSED. Reactive attachment disorder and disinhibited social engagement disorder are similar in that children with either disorder present with significant social impairment. The differentiation between the two disorders comes from their prognoses and their behaviors. Reactive attachment disorder is said by the DSM-5 to be caused by insufficient care, which has resulted in a lack of any attachment behaviors. RAD has a positive prognosis. Once sufficient care is introduced to the child, the disorder often resolves on its own. Disinhibited social engagement disorder, however, is characterized by attachment behaviors that are inappropriate or indiscriminate. Children with DSED may treat every adult as a caregiver, while children with reactive attachment disorder form no attachment to any adults, including caregivers. DSED has been shown to be persistent even after sufficient care is established. Early and middle childhood allow for a better understanding of the influences behind attachment disorders. Abusive or neglectful caregiving is considered the primary cause behind both attachment disorders, but additional risk factors can contribute in the form of parents' habits and behaviors. These include a mother's psychiatric hospitalization, preterm birth, limited prenatal care, substance abuse of the caregiver, and frequent changes in caregivers. Fortunately, treatments for certain attachment styles and attachment disorders are more prevalent for children aged 2 to 12, but these options can also be applied during infancy if attachment patterns are discovered early enough. Two promising options include attachment and biobehavioral catch-up intervention, or the ABC intervention, and group attachment-based intervention, also called GABI. The ABC intervention focuses on improving caregivers' behaviors and responses to their children's needs. The treatment consists of 10 weekly sessions, with each session lasting an hour. The sessions themselves are held at the children's homes, and each one focuses on building the parent-child relationship through different skills. The ABC intervention has been found to be successful and promotes physiological regulation and brain functioning. Group attachment-based intervention, or GABI, is similarly focused on nurturing the parent-child relationship. However, this treatment specifically centers around treating the adverse effects of trauma in the caregiver, so as to prevent the caregiver's past experiences from negatively affecting the child. It is offered 3 times a week, twice a day, and involves parent-child playtime as well as times for the parents to meet as a group separately from their children. The treatment has been very successful in helping parents develop the tools to provide responsive and nurturing care. When it comes to attachment during adolescence, most studies examine the ways in which the parent-child relationship affects the child's relationships with their peers. Most important to attachment research during adolescence is the internal working model, which applies what the child has learned about attachment from their caregivers to other relationships in the child's life. A fascinating finding is that the relationship between caregivers in terms of co-parenting can be a predictor of social success for the child. One study found that maternal positive co-parenting behaviors, or co-parenting behaviors that are cooperative and complementary on the part of the child's mother, predicted a high level of peer attachment and an overall positive attachment between the child and their caregivers. Conversely, paternal negative co-parenting behavior was found to predict a low level of peer attachments and had negative effects on the attachment between the adolescents and their caregivers. During adolescence, children become increasingly comfortable with seeking out support from peers, which simultaneously encourages the child to become more independent. In the case of a secure attachment with their caregiver, the child increases in independence while returning to the parents in times of need. In cases where the child lacks proximity to the caregiver, peer attachments can become a supplemental source of comfort and encouragement. In summary, parental and peer attachments set the adolescent up to enter adulthood. The final developmental stage that I'll discuss in this video is emerging adulthood, from 18 years to 25 years of age. Just as peer attachment is the main focus of attachment research in adolescence, romantic attachment is most central to attachment theory in adulthood. Multiple longitudinal studies have been able to tie infant attachment and peer attachment during adolescence to emotional regulation styles in adults, particularly when approaching conflict with their romantic partners. Literature by developmental psychologists outline 3 different romantic attachment styles: secure romantic attachment, anxious romantic attachment, and avoidant romantic attachment. Individuals who are securely attached to their romantic partners will seek them out as sources of comfort when stressed. Alternatively, those who are insecurely attached to their romantic partners will rely on a different emotional regulation strategy. There are 2 accepted categories of emotional regulation strategies in adults: hyporegulation and hyperregulation. Gurm et al. Define hyporegulation as the suppression of emotions and hyperregulation as the exaggeration of emotions. Popular examples of emotional hyporegulation include the use of distractions and social disengagement. Conversely, hyperregulation tends to involve rumination and a fixation on negative emotions. Generally, it is agreed upon that adults with avoidant romantic attachment tend to rely on hyporegulation strategies, while adults with anxious romantic attachment rely on hyperregulation strategies. Some studies have additionally tied anxious romantic attachment to clinging, controlling, and overly dependent behaviors that are meant to gain proximity to attachment figures. Other than adult romantic relationships, early attachments have been found to be linked to adult abnormal psychopathology. Early insecure attachment is theorized to act as a vulnerability towards developing certain mental disorders, such as depression, anxiety, PTSD, OCD, suicidal ideation, and eating disorders. Less understood but also widely accepted is the role of insecure attachment in certain personality disorders, with anxious attachment being associated with dependent, histrionic, and borderline personality disorders, and avoidant attachment being associated with schizoid and avoidant personality disorders. If there is one conclusion to be drawn by current research, it is that early attachment has far-reaching consequences across the human lifespan. While attachment may change in its presentation while we age, it never diminishes in its importance. Thanks to the efforts of scientists like John Bowlby, we have a better understanding of attachment today than ever before, and with this knowledge we can protect future generations from the harmful effects of abusive and neglectful caregiving. Thanks for watching.